year. So I'd like to welcome you all. I'd like to welcome a new member who's joined us a while back, but thought we had closed down for COVID, Tom Richardson. So welcome. Any other new members that we haven't welcomed? We're always delighted to have new members. Secondly, any guests with us tonight? Well, okay, Barbara, I'll start here and we'll come around. Oh, I'm sorry. Oh, there we go.
Thank you. I'd like to introduce my long-suffering husband, Jim Walters.
Welcome back, Jim. Jim, you may recall, gave a talk on the Way, the famous Pilgrim's Way in northern Spain during the summer when we were on a different schedule. And the other, Jack Urban, yes.
Connie Turner and I have a guest this evening, Reed Schultz, who is returning to Kalamazoo after leaving Western as a PhD physics major. And he's helping us with our video. He's the technical expert that some of you encountered earlier this evening.
Oh, welcome. Welcome back to Kalamazoo. Please consider joining Torch Club so we can continue the conviviality. Any other guests? Oh, over here. Yes, of course. And Dr. Khaghany.
Yeah, I have two guests. My grandson, Brandon,
Welcome, Brandon.
and Jessica, the girlfriend.
Welcome, Jessica.
Both of them are senior student at K.
Yay.
Brandon is accepted in dental school, and she is accepted, actually given many scholarships for law school.
Congratulations. Well, there are lots of doctors and lawyers here to offer you advice. So, any other guests? Spouses? All right. Well, welcome. And we have a very interesting presentation tonight. But first, a few sort of political announcements. The board met today, the High Command, and we are now looking for nominees who would then, need the vote of the club. So you may self-nominate yourself, or other people may propose to draft you. I would encourage that for 3 positions in the Torch Club for next year. Number 1, I'm president now, but I will ascend to consultant status for next year. And Tom Dietz is the next vice president. And so we are looking then to have a vice president volunteer for next year when Tom becomes president. So number 1, if anyone would like to serve as vice president, which does carry a bit of responsibility, program planning for the following year. So, but please, if you would like to organize our year, I would strongly encourage you to contact me or Jim Coppinger or other members of the board. Secondly, we are seeking a new board member for a 2-year term for next year. This doesn't necessarily involve moving on up, but we do need input from members. So I would encourage anyone who would like to serve 2 years and find out about the inner workings, the Star Chamber, which meets on the 2nd floor before our meeting, to please volunteer yourself, or if you have proposals, contact me or Jim or other members of the board. And third, now for a momentous announcement. As long as I can remember, our dues have been collected, and the club managed financially with great success by Joe Fugate. For so long, I can't remember when you didn't take care of our treasury. So this evening, in the hour before this meeting, Joe announced to our shock and dismay that he is planning to retire. So he said he will continue to serve until we find a replacement. So we are seeking a volunteer, hopefully with, who would handle our finances. It's not a big operation, but it's run so perfectly for all these years that we really do seek help to keep our finances in order. I can assure you they are in very good shape. I haven't been to the Caymans lately, but I hear that everything is perfect. Joke, joke, joke. But no, but seriously, but if any of you would be interested in serving as our treasurer, and please let me know, or Jim Coppinger, and we hope then Joe can ascend to his well-deserved retirement. You are an institution, Joe, and I can't say thank you enough. You have been the foundation stone of this club for decades. So that is the big news of the evening. So please file this away and start thinking of either serving yourself, or if you have someone to suggest, would very much appreciate it. So now the last item, of course, is our program. And tonight I'm delighted to welcome back to the podium Dr. Michael Khaghany, who has given some spectacular presentations in the past from which we have learned much. Dr. Khaghany originally came to us from Tehran University of Medical Scientists, arriving in the United States in 1970, and or 78, 70. And Dr. Khaghany stayed in the United States, decided in 1978-79, when momentous events took place in Iran, to stay. And Iran's loss has been America and Kalamazoo's gain. Dr. Khaghany has been for 35 years a renowned cardiac and thoracic surgeon. And Dr. Khaghany for 35 years took care of a lot of us in Kalamazoo, including some members of our club who I think owe their lives to him. And since he's retired, his passion for continuing education has continued. He has taken courses in mathematics, astronomy, astrophysics, physics, biology. But, his first, most important focus has still been cardiology. And Dr. Khaghany told me tonight that he has performed 8,600 surgeries. So all these lives saved. I think perhaps even a few members of our club owe their lives to him. So for 35 years of life-saving medicine and advancing cardiac surgery, I give you Dr. Michael Khaghany.
Well, thank you very much. Thank you. I use this one.
Okay.
Yeah. Thank you. Well, hello, everybody. Good evening. Let me turn my computer on. I hope it works this time, because there was a problem earlier. Oh, they come back. Good. That sounds good. Okay. I'm going to be very brief because the time is short. But this is amazing stuff for the past 100 years, 120 years now, since exactly to be exact. Around 1900, we have witnessed lots of development, which every one of them need to be a book, truly, when you look into it. And most of these advances happened by the scientists in this country. So the world owe a lot to the United States because of the great universities that we have. Harvard, I'll mention some of them, Columbia and Stanford amongst them. So I will start with few yeah. Can you well just push this, right? Brandon is my computer expert here.
There you go.
What do you want? Just push this one? This one? Okay. Yeah. Brandon helped me to actually to make these slides. So I'm going to start with few historical statements. One of them is by Dr. Theodor Billroth, who was the most famous surgeon in Germany, to be more accurate, Austria. He made this claim. He said, whoever tries to open the heart or touch the heart, actually there was nothing about opening it. Opening means a cadaver. Touching the heart, he's crazy. He should lose every respect, whatever he has in the community, because heart is just not touchable. So here, this man claims this thing in 1881. He's the most famous surgeon of the world. He has written books in surgery. In fact, today, if you open the book of surgery on the gastric operation, you can see the name Billroth 1, Billroth 2, because the way he designed his operations, and they're universal, they're great. He was a great scientist, a great surgeon. So when he claims this, it's hard to dispute his claim, right? So along with him, a great physician in England, Paget. You all have heard about Paget disease. Paget was a very famous physician. In 1896, he made this claim. He said, we have reached a point that there is nothing else we can do about the heart. It's just not possible. How many times you have heard this thing from other branches in science? I know for sure I heard this in astronomy. Some French great astrophysicists claim that we will never know what's going on in the other stars because we can never reach them, not knowing that there is a technique that will come up, which we know we don't have to be there, but just by analyzing the light, we know exactly what elements exist in that part. So a state of heart disease in 1900 was not that good. There was no diagnostic tool. X-ray was just discovered around 1896 by Röntgen in Germany. And the best we could do, just take a chest X-ray. That's all we could do. None of this stuff that we have today. As far as the medication, the only thing available was digitalis. It was discovered by British physician, Dr. Withering, around 1885. That was effective in treating congestive heart failure, but really didn't have any impact on the longevity. It made you feel good, you made some diuresis, get rid of some swelling, shortness of breath, but eventually it was a poison. If you go above certain limit, the spectrum was very narrow. There was not much impact on the outcome of the patient. There was no surgery, absolutely no surgery. The only thing was an exception, which I will mention that one case was reported from Germany, which I'm going to show that on my slide, by Ludwig Renn. Beside this thing, there was nothing else. So it reminded me of what Voltaire said. Well, the art of medicine consists of amusing the patient while nature cures the disease. How true it is. How true it is. It is also true today, by the way. But we have many other tools to help. But most of the time, the physician is a psychologist, psychiatrist, who hold hand, he makes some reassurance so the patient feels good, and he knows deep down that this cancer is not going to go away, it's a terminal case. So what do I have in my armamentarium? We can say some chemotherapy, supposedly, but I know deep down that for that specific case, it is not effective. But so Voltaire was very right. And in fact, I remember a case of the King of England in 1852. He was supposed to come out of his room every morning about 7 o'clock, supposedly. This time didn't come out. So the guy who was in charge, he was wondering what to do, go wake him up, not wake him up. Finally, he decided, oh, go find out he's just lying flat, lying flat. So anyway, to make the story short, the doctor comes in and what they do, they order enema. What is next day? Another enema. And then say, okay, let's do some bloodletting. So they took his blood out. So after 8 days, the king dies, and they did a post-mortem exam. He had aortic dissection, which never knew anybody know but at that point, and that was the first case of reported dissection in the history of cardiac surgery. So how was the art of medicine? But exactly what Walter said. So, by the way, most of the people I'm going to talk about tonight, they have most of these characters. If not all, perhaps most of it. I call them misfits. Because they question every existing axioms. Any myth, they questioned. They didn't accept it just on the face value. They relied heavily on their own feeling and intuition. They were willing to take risk. They were not upset with somebody criticized them, and kept on doing it in spite of failure. And you will see over and over this happens in the history of medicine. And they were non-conformists. Basically, they were just different kind of people. And they had a great self-confidence. So what I'm going to talk about are the anatomical part of the heart. I'm just going to briefly mention every piece of it, what had happened from then to now. The muscle that pumps the heart, we call them basically the ventricles. There are valves which direct the flow of the blood, and there is electrical system to conduct the contraction and synchronize the motion. Without that, we are going to have trouble. And then the last, of course, the most important part is the coronary circulation to feed this muscle. Today, about 600,000 people in the United States every year have heart attack. 400,000 of them die suddenly without having any symptom prior to that. It's a huge problem. It's a huge problem. It has to do with coronary disease. And we didn't have any idea what the heck is going on up until perhaps 1970, 1968, which in Cleveland Clinic, lots of stuff came up. So just to make this story a bit easier to understand, I'm going to use my, see if that works. That is off on now. Okay. So the heart, the one I mentioned is the ventricle as the main part of the heart. This is a muscle, pure muscle. We have two hearts. We have right heart, left heart. We have, each heart has two chambers. The upper chamber is called atrium. The lower chamber is ventricle. This is where the action takes place. This right heart receives the blood from the entire body through the superior and inferior cava, and then leads them into the pulmonary artery, which is this blue line, is behind the aorta, and then goes to the left lung, right lung, and then after oxygenation come back through these veins called pulmonary veins into the left atrium, go through the mitral valve into the left side and pumped into the main pipe aorta, goes everywhere. So the lung, we have two circulations, a small circulation, which is the lung, which this picture doesn't show, and a general circulation, systemic circulation, which is our body. So, and this is the electric system which I mentioned. This signal comes from here. This is the conductor. This is the same way to node. Signal from here goes to the atria and then goes through the ventricle and simultaneously stimulates, so the contraction would be synchronized. You can have this piece contract and this relax, or this septum stays loose. That wouldn't work. They all have to work together in a synchronized fashion. And this is done through the orchestration of this electric system we call Purkinje system. The valves, like here, it helps the flow of the blood is one way. The heart contracts, it cannot go back again, so it goes forward. The same thing on the left side is called mitral valve. And I'm going to mention, this is called septum, which I'm going to stress tonight on few cases. This is called ventricular septum. There is another septum up here behind the aorta, which is called atrial septum. So, so what happened to the heart? Some people are born with congenital heart disease, about 1%. 1% of babies born today are going to have congenital heart disease. Fortunately, we have a surgical solution for most of them. The rest has to do with what we gain after we are born. Of course, trauma, don't forget about this. Coronary disease, the most common tragedy of the human being. The valvular heart disease, fortunately less of it because rheumatic heart disease is controlled. Congestive heart failure, if you have 2-3 heart attacks, most likely you end up with this because there's not much muscle left to pump the blood, so develop what is called heart failure. Or if your valve doesn't work well. And then the rhythm problem, which has to do with the electric system, which I showed you the picture of it. So, the story of this man is very interesting. This is a surgeon, German surgeon, Frankfurt, Germany. Years is 1896. The police found a person who was stabbed in the chest in Frankfurt. All he noted was that he's semi-conscious. He's not totally with it, but he was holding his hand on his chest like this, and then he saw some blood. Police took him to the hospital. The doctor on call examined him. He made a correct diagnosis that the lesion was the laceration of the heart. So he said, okay. Bill Roth said, don't touch the heart, so we're going to send him to the room to die. That's what happened. They sent him to his room. This is 12 midnight or 2 o'clock in the morning. They sent him in his room. Ren comes in the morning. He's the chief surgeon. He comes in the morning making around. He found out there's such a patient in that room. He goes there and examines the patient. He sees that he's in shock. The blood pressure is dropping. He's basically dying. He put his hand on his chest. He tapped the chest with his fingers like this. They call it percussion. And he figured out the silhouette of the heart, which has to be the size of my wrist. My fist is now 2 or 3 times as big. So he made the diagnosis that the patient is bleeding inside the precordial sac. The sac is the layer that holds the heart. He figured out the blood is now collecting and pressing the heart and making him to lose his pressure. He said, take him to the operating room. This is amazing what he did. He take him to surgery, put the knife here, put him asleep, of course, opened the chest. He found exactly what he thought. He opened the sac, the blood shot out. But now he has to deal with this hole in his heart, in the heart that caused the bleeding to start with. He put his finger on the hole, and he, for the first time in the history of mankind, he put his sutures inside the heart, in and out, ties them very gently. When the heart relaxes, he ties them, so doesn't tear through. The patient made it. He left the hospital after a couple of weeks. So this historical case proved that Bill Roth was wrong. So it comes to World War II. This is the American surgeon, Dr. Dwight Harkin. He's a professor of surgery in Harvard. War breaks out. This 35 years old was sent to London to be the chief of surgery in Army hospital, which US has set up because London was bombed constantly by Germans at the beginning. Now they're sending V1 and V2 bombers or rockets. So lots of people got injured. So he sent him to London, and what he did, he was able to successfully remove close to 133 shrapnels from the chest of these patients, the soldiers mean. And out of these, 16 were in the heart. So the first time he saw this bullet in the heart, or piece of shrapnel in the heart, he didn't know what to do. He was thinking about Bill Roth. He was thinking about Ren. And he was thinking, if I leave it here in the chest, the patient is going to die, going to get infection, or the bullet or shrapnel is going to move. So he talked to his superior. They both decided for him to go to proceed and do it. Wasn't that he didn't have experience. He had a lot of experience in the lab on the dogs. He had worked a lot. He knew how to do this. So he put a forceps on this, not a forceps, clamp on this shrapnel. While he was doing this, he put sutures in the heart, but this time he used some augmenting material. They call it plugets, which he came up with. And he successfully pulled the bullet out and sutured the heart. This is the right heart. But once he finished, he found that his glove is sutured into the heart. So what to do? He just took a scissor and cut the piece of glove, left it in. because you know if you go and cut it out, the patient is going to be dead. This patient survived, and after that he reported 16 more cases. And when they reported this the anal-thoracic surgery, he quoted Bill Roth and the one I quoted for you tonight, few other, including Aristotle, by the way. He also said something about the heart, which I didn't have time to put in here. So he became very famous. He worked some on the concept of intensive care unit. He's actually developed this, and he did some surgery on the mitral valve, which I will mention maybe later. Before we go any further, I'm going to say how we came up to make this diagnosis. The heart, we only had chest x-ray. We have to find somehow what is wrong with the heart. If you don't know the diagnosis, we're going to make a mistake. So who was the first to tackle this problem? Was this German physician, Mr. Forsman. Forsman was only 24 years old. This is 1929, Germany, north of Berlin, about an hour northeast of Berlin. He was basically a resident in training. So he came up with an idea. He said, well, why not we give this medication that we are giving to patient directly to the heart? If we do that, maybe it's more effective. He was thinking. You just have to imagine things before you do something about it. So he went to his boss. He told him about this. He said, you're stupid. Don't say again. Don't mention this. You want to put a catheter into the heart? What a crazy idea. Don't you know that you kill the patient right away because the heart is going to go into crazy rhythm, the core fibrillation, patient is going to die? Well, that was his boss, so he accepted it. But then 2 days later, he went back to him and said, what if I do it on myself? Is that okay? No. He said, no, absolutely no. You are not allowed to do this in this hospital. So on the surface, he accepted, but deep down, he wanted to do it. So he goes around, he thinks about this, he come up with this plan. He go charm this nurse. He was a young guy, good-looking guy. He charmed this nurse, her name was Gerda, who was in charge of these closet, which had all this equipment, the scalpel, the urinary catheter he wanted to use, sponges, anesthetics, all these things. So after 2 weeks playing with this girl and convinced her to do this together. So they go there one day, they open the door, they open the closet, and they sneak, get this stuff, and they come out, go find another private room, and they close the door. She put Gerda on the table, on the bed, ties her down, and then ties her arms down. And she doesn't say anything because she was infatuated with this guy. He just loved him so much. Now I can do anything. She thought he's going to do this on her. But guess what? He took the scalpel, he cut his own hand, his own antecubital fossa here, where the vein is, where this great cephalic vein is. He exposed his vein, he did cut down, he passed this catheter. It's a urinary catheter that you put in a bladder for the urine, but they had no catheter for the heart. He put that into his vein, and he pushed it about 1 foot, got to here. So he then opens up this, he releases Gerda. Together, they rush to the radiology. So the radiology technician didn't want to have anything with this. He started making a commotion, shouting and yelling and this. A doctor who was on call next door woke up, and there happened to be his friend, his drinking buddy. He said, what the heck you're doing? You're crazy. You're going to kill yourself. Don't. So he kicked him in the shin. He dropped him here. He jumped into radiology, turned the machine on. In the meantime, he passes the catheter another foot or two inside his heart. So the radiology, his scope is on. He sees the catheter clearly in the heart. He take a picture. Took a picture of it. He took it to his boss, who didn't have any idea what the hell is going on, and he told him, sorry, I just did it. So the boss didn't know what to do with this crazy man. He already has done it, and he didn't die. So this idea that if you touch the heart with the catheter, you die. No, he didn't die. So he let him do 16 more times on himself, till he ran out of veins. He published his information in Annal Cardiology in Germany, and every cardiologist hated him. They all said, this guy is crazy, this should have not been done, they should have not allowed him to do this. So he was seeking to get a radiology residency. No, he couldn't get one. So he became a urologist. But he proved to the world that you can do it, that you can send a catheter and the patient will not die. So these two in New York, these are Bellevue Hospital, there are two physicians, two cardiologists. They, based on Forsman idea, they came up with a catheter for the heart. Now they injected the dye inside the heart. They can take a picture of the heart. They can measure the pressure. And based on the pressure, they can assess whether the valve is incompetent, whether its valve is stenotic. And cardiology just revolutionized because these Forsman. The three of them got Nobel Prize in '56 for what Forsman did. So you think this guy was not crazy? I mean, everybody would say it's crazy. But you have to be crazy to do this kind of stuff. So this happened then. The heart, the pictures are taken. We know good, better about what's going on. But we didn't know much about coronaries because coronaries were the main killer. What are going to do with that? We can't take the picture of coronaries because everybody thought if you put a catheter in the mouth of the coronary, the moment you inject the dye, the patient will fibrillate. Fibrillation means goes to a chaotic rhythm and die. So what happened, Mason Sones, who was working in the Cleveland Clinic, this is 1958. He had a patient, he had rheumatic heart disease, he wanted to study. He asked his resident to go ahead and put the catheter and inject the dye. By then they have come up with this automatic machine that can shoot the dye with a very high speed. Perhaps they can deliver about 20 to 30 cc, about an ounce of dye within 3 seconds. So the moment they did that, the tip of this catheter started playing like a hose. You suddenly open the water, it started to jump like crazy. So the tip of the catheter was in the aorta, jumped, and went right into the right coronary artery, which one is supposed to do that. They didn't know they were there. They took the picture. Oh my God, Mason saw the picture. Mason almost passed out because he knew the patient was going to be dead. For 12 long seconds, heart stopped beating because there was no oxygen, no blood going. But then it started coming back. The beautiful rhythm came back. So he proved that you can take these pictures without any risk. So this is the beginning of figuring out what's going on with the coronaries and then coming up with a solution. So Mason Sones in Cleveland Clinic 1958, he came with this stuff. Mason was, I'm going to say the story, Mason was honored in 1980 in Cleveland Clinic. There was a gala to honor him for what he has done. And all this is a black tie. All the big shots were there in big room. So after the guy introduced Sones for 10 minutes, talking about how great he is and blah, blah, blah. So asked Sones to come to the podium. So Sones, which already had spent a lot of time in the bar, he was kind of shaky and drunk and wobbly. He finally got to the podium. And after he got to the podium, he waited about maybe a minute. Everybody's waiting to see what he's going to say. Then he opened his mouth. He said, well, you know, whatever the environment is, you are. So he stops again. So another minute passes. The people are wondering what he's going to say. And he says, well, I'm sorry, I'm going to say exactly, not exactly, but what he said. He said, well, if the people around you feel that you are this bad word, I don't want to say it, then you are, and left. With that, then he left the podium shaking and wobbly. They can help him to his seat. So people waited another 10 seconds and then stood up and all clapped for him for his success. And finally, 3 years later, he dies. He dies the same way that he lived. He dies while he had a cigarette in his hand from lung cancer. So again, these are misfits. These are different kinds. And I had well, I don't want to take too much, but I have my own personal story with him when I was in Cleveland Clinic. The congenital heart disease It started with this man. With this man, Alfred Blalock. This is 1944. Blalock was a famous surgeon in Vanderbilt, Nashville. He was working in a lab on the dogs on the hemorrhagic shock. And he figured out why the patient developed shock, which helped the victims in World War II quite a bit. At that time, he had an assistant. He was a black guy. He was a very bright man. He was only 18 years old. He just finished high school. He was the son of a carpenter. He was very good with his hand. He hired him to be his assistant because he was very busy in the lab. He had a lot of work to do. He needed somebody to come help him out, to set up the machine, to put the dog to sleep, to open the chest of the dog, and so he can work on it. So this fellow, very shortly, became expert in setting up the experiment. And there they did a lot of experiment in Nashville. Finally, Blalock was hired in Baltimore, Hopkins, John Hopkins University, very famous, of course. And with him brought him. But they, you know how the situation was, they only hired him as a sort of janitor. That was what was hired as, because they couldn't say that he's a surgical assistant or a technician, something like this. It was not just allowed. And he couldn't get to the Hopkins from the front door where the doctors go. He has to go from the back always, because the black were not allowed to do that. They have to go from a special door. So when he had this lab coat one day, everybody's looking at him, say, what was this black guy doing with the lab coat? They didn't know he was working in the lab. But Blalock had a lot of respect for him because he was so talented, so talented. Then came along this lady, which is Helen Taussig. Helen Taussig had a hearing loss because of infection, but he became a doctor. He became a cardiologist, pediatric cardiologist, and he had a collection, maybe 100 specimens of patients with congenital heart disease. So she was the most expert in the world, and she has written a book on congenital heart disease. So she knew in and out of all these congenital abnormalities. So three of them together, she actually came up with the idea how to help the blue babies. I'm going to show the slide of blue baby and come back to these guys. This is what the blue baby was. The blue baby are the ones that are born with a very complex congenital problem, but because the time is short, I'll just show you. The septum, that wall between the two hearts is missing. See here? So the blood from here mixed with this side. That's one major problem. And the other thing is that pulmonary artery, which take the blood out, is narrowed. So what happens, the blood, instead of going to the pulmonary artery to the lungs to get oxygenated, it goes directly to the left side and goes to the body. So they were all bluish, always, especially when they were crying. And they've learned how to squat. When you do this, the venous return improves and they get better. So they only had a very short life, maybe 10 years, if they were lucky. So this was the state of the art. There was nothing they could do. So that lady came up with a suggestion. She said, why not we do this? We take the artery from the arm. This is the artery going to my right arm. Connect it to the pulmonary artery which goes to the right lung. So this way, the blood would go back into the lung and get oxygenated. And when they come back, would improve. What a magnificent advice. So with this, Blalock went to work, and with the help of this man, he was a great technician. He didn't know how to do this operation, but he helped him. He did a lot of it on the dogs, about 100, 200 dogs. First he created this lesion, then he fixed them with this shunt. And then in 1944, he did the first surgery on a 4-year-old girl who had this tetralogy, and he was on his side. He was not allowed to scrub because the licensing is stuff. He was working in the lab. You can't touch the patient. But he was staying next to him and give him advice what to do, how to do it, put the clamp here, take the clamp off, put this suture, that suture. So the surgery was a success. And then after that, they did 1,000 more of this. He became the most famous man in the planet. Nobody knew about him. In fact, when he received honor, all these things, even didn't mention his name once. If you're interested more to know about him, there's a movie about him on HBO. You can watch it, the Vivian Thomas. So the situation changes later on when they found out that justice was not done. His resident, Cooley, which was the greatest surgeon, passed away in 2016. Denton Cooley was trained by him. So in 1969, the residents who now become big shots all over the US, they all came together to make a big oil painting of Vivian Thomas. And they put that next to Blaylock. So when you go to Hopkins now, you can see Blaylock, and next to him, you see Vivian Thomas. This was given by his resident, who was so much trained, so much help by him. And of course, the rest of the story is that they gave him an honorary doctorate, but not in medicine, because it was not allowed. They gave honorary medicine in law. Hopkins gave him honorary medicine in law and made him surgical instructor in surgery, some exception. So that's a story of the congenital heart disease, how it started in Hopkins, and the rest of it is just a story. Now I'm going to go back to what acquired heart disease is. Then the mitral disease was very rampant because lots of people have rheumatic heart disease. Rheumatic heart disease has to do with sore throat. You get a sore throat with a streptococcus once, twice, 3 times, you get heart damage because the antibody that body makes act on the heart and damages the heart. So lots of patients in the US, all over the world, had rheumatic mitral stenosis. It usually becomes tight. Mitral valve has 2 lips, up and down. When we become tight, this corner shuts down. So like my mouth is commissure, it's closed down, only the central opening. So anyway, this guy lost his father when he was young from rheumatic heart disease. At age 42, his father coughed blood and died. It was from the mitral valve, which was the stenosis. So he felt that he has to do something. He has to become a doctor. He has to become a surgeon and tackle this problem, which he did. So he got his degree from New York and then went back to Hahnemann, where he was undergraduate, and there started in Department of Cardiac Surgery. He went in the lab on the dog and worked on the heart. This is the heart, this is the left atrium, and this is the mitral valve. So he figured out if you make an incision here, remember we didn't have any way to protect the heart. He made incision in the dog, put his finger, and with his finger poked through that hole, the mitral valve. So teased it open with his finger. He said, why don't we do this in human? And exactly this is what he did. Put the patient asleep, made the incision, put his finger into the mitral valve, which was very tight, and forced his finger into the opening and made it open. So most of the time it works, but sometimes you just tear the mitral valve. It doesn't work. Of course, you don't know what you're doing with your finger. You're passing it into, and then you have to deal with this tissue, how to close it. This is a very, very fragile tissue. I was very scared myself in the operating room working in this area because it was so fragile. I have to use different techniques to deal with this. So I always just avoided this zone. But he did this. The first patient bled to death. Didn't work. The second patient tore the valve. 2 days later, the patient died. This happens in Hahnemann. So Hahnemann stopped him. He said, either you give up or we're going to take your cancer privilege. We're not going to allow you to do any more killing. So he went back to the lab for 6 months, working dog. This time, he went to another hospital, Wilmington Hospital in Philadelphia. He did surgery on a young person, and that patient, after 5 days, died. So they took his privilege. So only one hospital left, 2 hospitals left. One was the Philadelphia General Hospital, and the other one was Episcopal Hospital. Episcopal Hospital, I worked there. I was the resident there, so I know that place very well. That had my training in Episcopal. So when I read about him, I was very excited. So he goes to schedule 2 patients. The first patient was scheduled in General Hospital, Philadelphia. Patient survived the surgery. but 5 days later dies from rhythm issue. But the patient is scheduled in the afternoon in Episcopal. He already came with the design to put a knife on his finger, and with the knife goes inside and wiggle inside and cut this valve. That patient survived. That patient survived. This is the fourth patient now. 3 of them died. The fourth one survived. So a week later, he takes this patient with him on the train to Chicago, to the American College of Chest Physicians to introduce him. So he goes, he introduced him. It was just huge, huge excitement by this group of surgeons. Wow, what a magic work we have done. So he became world-renowned famous. And from that on, he kept on doing more than 1,000 of this done with only 8% mortality, which is commendable, knowing what we had those days. Mitral valve is not a good organ to work with it, very high risk. So thinking 1,000 patients only lost 8%, that was magnificent work. And then time, of course, made him the man of the year. He, later on, by the way, at age 53, he retired, and he decided to go to law. Can you bring me some water, Brandon? My water, yeah. He decided to study law because he was sued so many times. He wanted to be a lawyer. So he became a malpractice lawyer, by the way, and defended the doctors. At age 81, Cooley did his valve. He had a aortic valve problem. Replaced the valve, and a year later he died from pneumonia. But on his 80th birthday, guess who was there? The patient who operated in Episcopal. He came to visit him. So all these things, we didn't have a way to protect the heart. The only way you can overcome this problem is you have to stop the heart, you have to stop the circulation, you have to open the heart, and there's no way to do this without some support, because the patient, the moment you open the heart, what do you do with the circulation, right? So these ideas came up. This is a Canadian surgeon, Bigelow. Bigelow found out about this hypothermia. He figured out the groundhogs in Canada, when they go under the ground in a 0-degree temperature, they survive the winter. So he said, something must be about this hibernation. He worked on the bears' hibernation in his lab, and he came up with this, that if you drop the body temperature down, you can slow the metabolism, and then you can, instead of 4 minutes only time for the brain to survive, you can stop the heart for 10 minutes, 12 minutes, depending on temperature, without causing any brain damage. So this was a concept of hypothermia. So guess who tried this first? Bailey, which I showed you, that lawyer was sued. He tried that in Hahnemann. He put the patient, brought his temperature down to 80 degrees Fahrenheit, put him in the Sears tub, ice over him, and they dropped the body temperature all the way down to 80 degrees, brought him up to the operating room, opened his chest, and opened his atrium. In 6 minutes, he was able to do the surgery, not 12 minutes. He finished the work. It was fast. It was just magnificent technician. But to his surprise, as the temperature comes up, the heart starts fibrillating. It's not coming back. So what it was, he forgot to de-air the heart. Air was locked into the heart, and that air went to his coronaries, and the patient died on the table. So this is that crazy Bailey that I told you about with mitral valve. 3 days later in Minnesota, the surgeons figured out what had happened with Bailey. They did the case, similar case, the patient survived. So that was the proof that the concept works. But still, you're talking about 10 minutes. 10 minutes is not going to do much. So we use this today. Hypothermia used moderately in open heart surgery, but deep hypothermia means bringing the temperature all the way down to 64 degrees, 65 degrees Fahrenheit. You can do that on the heart-lung machine. Then you can open the heart, you can open the aorta, you can take the blood out like a cadaver, no circulation, no drop of blood inside the patient. You can see inside the heart. In fact, I could see the takeoff of the arteries going to the head. That's amazing, amazing view when you are seeing this patient on the table dead. And you can see inside of his carotid from here. And then you do the magic, reborn the patient and wakes up. This is called deep hypothermia, which is practiced for complex cases. This guy, Mustard, again, Canadian surgeon, he got an idea from monkeys. He said, well, why don't we take the monkeys' lungs, take them out, take those lungs, wash them, and then use them for oxygenation. So send the blood from the patient into the monkey's lungs, let it get reoxygenated, and bring it back to the patient. In the meantime, you can stop the heart and work with the heart. He did that on the dogs several times. It was successful. He brought it to the operating room. The 12 consecutive cases he did with this monkey's lungs, all of them died. Didn't work. And they figured out why they didn't work, because the monkey's lung, no matter how good you wash it, there's a reaction, there's immunological reaction to the circulation of human and monkeys. So this monkey's lung idea didn't work. So come here to Minnesota, our neighbor state of Minnesota, Walter Lillehei. Walter Lillehei was working in the University of Minnesota, about 65 miles from Mayo Clinic, where another major center of heart surgery was about to develop. So Walton said, what about babies? Mother raised the baby 9 months in the uterus, baby get fed. Why don't we do the same idea? Why don't we connect the human being to the mother and let temporarily the mother protect their circulation while we stop the heart and we open the heart, we work on it. This is a very interesting concept. It's called cross circulation. Let's say you have a mother on one table, baby on the other table. You connect them with the tubing. The femoral artery of the mother goes to the patient. The vein goes to the mother. Get oxygenated, come back. All you need is a pump to pump the blood back to the baby. So this circulation, cross circulation, it happened in 1953 or 54. This is very much March 53. This is the same time that U.S. Succeeded in blasting the hydrogen fusion bomb in South Pacific, in Bikini Island. 15 megaton bomb was exploded then. It was in papers. At the same time, this guy creating a lot of controversy in the University of Minnesota. There was a fight between the surgeon, the head of the Department of Surgery and the Department of Medicine, Watson, arguing that you should not do this is unethical. You're going to kill two persons at the same time. And that's right, because mother and baby, if you kill one, kill the other. So they were totally against it, but Weinstein, the head of the department, was very strong. He was able to convince the rest of them, let Walton go ahead, because he has done a lot in the lab. So the crazy Walton did, the first case didn't succeed. Patient developed pneumonia and died. The second case, however, was a beautiful case. 4 years old Anna was dying from the VST. From VST was between the two ventricles. So he brought Anna to the operating room. The mother, by the way, the blood would not fit, so they used father instead. This is interesting. For the first time, baby is related to mother, being now to father. So brought the father next table, put him asleep, connected. He fixed the heart, he fixed the hole, but for 90 seconds, the heart didn't come back. Developed what is called heart block. So here he's looking at this heart. He knows this patient, if it doesn't come back, is dead. But luck with him, patient heart rhythm came back after 90 seconds. He closed the heart. The patient survived. But what he did, a week later, he had a press conference, which was no-no in the medical field to go and advertise. And he brought all the world came in, because really this is the first time anybody had been able to fix this defect in a human being. So the press conference, and then he started explaining what his body has done, and they brought Anna on a wheelchair to the press room. So now everybody sees Anna and see the parents, they're happy. So he did many more after that, but still, when he lost few more cases, they found that this technique is not the way to go, and we have to figure out something else. Walton Lady High, he became the chief of surgery in New York, Cornell University, very famous then, and still is. They made him chief of surgery, but Walton was a crazy man. He had nothing to do with surgery. He would go to bars every night, and at one time, he left his wife and 2 kids in Minnesota, and somebody punched him in the face because he was drunk and all this. He wouldn't go to the meeting. He wouldn't go to conferences. He would say, you know, just. And the last thing he did, he wrote on the stationery of Cornell on behalf of Hubert Humphrey, who was then the senator in Minnesota. He brought on this stationery for fundraising. When he did this, Cornell got very mad and summarily kicked him out. They took him off his position. So 3 or 4 months later in St. Paul, Minnesota, IRS went after him, and it was a very messy situation for what he has done, and ding, ding, ding. So finally, jury voted against him, and judge made him pay $50,000 fine and 6-month community service. So his license was taken, no more surgery. At age 53, he retired, but then situation changed somewhat because the board realized what he has done. He became the head of the St. Jude Industrial System Complex, and he was sort of rejuvenated again, like Phoenix. He was risen back again. Eventually died from pneumonia, but again, in his birthday, in his 70th birthday, Anna, that by then now was a grandma, came and visited and surprised him. That was that 4-year-old baby that he had fixed. This is him. This is Walton Lily High, the great Walton Lily High. This is his light. He did the first successful repair of internal septal defect using cross-circulation, the first external pacemaker, and significant contribution to development of heart-lung machine, which I'm going to talk next. This guy, Gibbon, John Gibbon, came from a very rich family, from 5 generations of physicians. He was born in Philadelphia. He was trained in cardiac surgery in Massachusetts General Hospital, which was the most famous hospital in the planet Earth, under Churchill, who was the head of the department. And one night he was on call. He saw this lady who had gallbladder surgery is dying. And to make the story short, he had a blood clot which has moved from his legs to his lungs. And the only way you can cure them, then we didn't have this treatment we have today. The only way to treat this, she was in shock, is the surgery. And of course, we don't have heart-lung machine to do the surgery. But Churchill decided to open the pulmonary artery, temporarily clamp the veins, and put his finger and see if he can pull the clot out. Didn't succeed, and patient died. But the idea came to his mind. He said, if we only had a machine to take the blood out of the patient, oxygenate this blood, send it back to the patient, this patient would have survived. This was the seed of thinking in his mind to come up with this idea of heart-lung machine, which he pursued for the next 19 years. Finally succeeded. In 1953, while he was working in Jefferson, in May 23rd, 1953, Jefferson University, 18-year-old girl with this big ASD, took him to the operating room. In 23 minutes, he fixed that, and it became the first known repair of a person using heart-lung machine. Heart-lung machine. This heart-lung machine was developed with the help of IBM company. He had connection with the High Society of Philadelphia, where the IBM was, and the IBM assigned 5 engineers to work with him, and with the help of them, they were able to come up with the oxygenator, which was a different kind of oxygenator called film oxygenator, which is not used anymore. The new oxygenator, of course, is called membrane, which is a significant advancement. It's just this size, from huge size that was then. So the whole surgery now is done with the membrane oxygenator, and you can do 4 or 5 hour surgery with the patient on a lung machine and open the heart, do all kind of work, and the patient will survive. That was contribution of Gibbon. But Gibbon did 2 more surgery when the patient died. At age 49, he quit surgery. He said, the machine is not good enough, I'm not going to do it. But who followed this? crazy Walton Lilly in Minnesota and Kirkland in Mayo Clinic. They perfected the machine, and they were able to do a lot of complex surgeries, and Kirkland especially brought the mortality of surgery down from 50% to 5% on congenital heart disease in Mayo Clinic. So contribution goes to this great man, Gibbon. This is a heart-lung machine today. These are the pumps. These are all electronic, and this is the reservoir the venous blood comes in. The oxygenator is a very small device which is back here. This oxygenates the blood and then send it back to the patient. Basically, you take the blood from the patient. Here is the venous blood coming into this reservoir. From there goes to the oxygenator. The venous blood turns into arterial blood, pumped, passes through a filter into the patient. So this way, I can stop the heart because all I have to do is take the blood from inlet and bring it back to the outlet. Then I can open this heart, put a clamp here, open the heart, bypass, do all kind of work you want to do. As I said, you can do it for 4 hours very safely. So the problem was solved. Now it comes to the valves. What to do with these valves which are not working? It fell to a star. A star was only 31 years old when he was hired by Oregon to open up the Oregon Research Center in Portland, University of Portland. And the first visitor came to see him was this engineer. He's 60 years old. He's 31 years old. He came and tell him he has his own problem with the heart. So that was his motivation. He came to him and said, I'm going to help you to develop an artificial heart. He convinced him that before we do this, let's make artificial valve first, because that's the first step to do. Because there's so many patients with valve problem, let's work on that. He was hydraulic engineer. He had 62 patents by then, and he promised that he's going to do it. Edward went to the lab. He came up with certain designs for the mitral valve. The first design didn't work. They did it on the dogs. The yeast, it came apart and then blood clot formed, but came up with this simple design, which is, to me, is the most beautiful design. It's so simple. This ball, it's called silastic, moves up and down in this cage. So the blood goes this way, and then cannot return, because the moment when it returns, the ball comes right here, closes the orifice. So what a smart move. Is a one direction, one way. So when the chief of cardiology came to visit him, he saw a lot of dogs are living in the laboratory. He told the star, why not, I have a very bad patient, dying, young lady, 31 years old. Why don't you do something with him? He was not ready for it yet. He said, well, I need to do a bit more work on the blood clot formation, all this. But he felt very bad for this patient who was dying. He said, let's do it. They took the patient to surgery, and he was very pleased. Opened the chest. He found the surgery is much easier on a human than the dog, because the heart is much bigger. So he replaced this valve, the mitral valve, with this. Patient is fine. Night of surgery, let's say 8 o'clock at night, a star goes to visit the patient. She's talking to him and asks a star, can I move to my right side? Because I'm getting back pain, lying down too much. So the nurse came, a star helped. They put her on the right side. The moment they did this, almost instantaneously, she grasped for air and died. Can you imagine? You're a surgeon. You go there and you're full of happiness that you have done such a magnificent job. Go there and help the patient die. He was beside himself. They did a postmortem to see what had happened. They found out air was locked into the heart. And when they moved the patient, the air moved out of the heart and went into coronaries and the brain. So it's like any pump. If you don't de-air the pump, it's not going to work. So this is the first lesson he learned, that you have to de-air the heart. That patient didn't make it, but many patients after that survived the operation, and soon they attacked the aortic valve a year later. So the valve replacement became very routine because of a star. Now here, let's go back. Here are the valves now in the market. This is the best valve. Brandon, can you show the valve? This is called St. Jude valve. Consists of 2 leaflets. These are the leaflets which are hinges here and here, and they are very light. They are pyrolytic carbon. Pyrolytic carbon is very much show the let pass so everybody can see it. You can touch this valve, see it, and then bring it back to this at the end. So this pyrolytic carbon moves very easily, very readily. It doesn't take much effort to move it. This is called St. Jude valve. Came in market around 78 when I was in Cleveland Clinic. Before that, we were using this. I remember, used awful lot of this valve. But so this is St. Jude valve. Then Carpentier in France came up with the idea of pig valve. This is from the pig. This is the leaflet of the aortic valve of the pig, which they have put it on formaldehyde to fix it chemically. There is some aldehyde bonding, so it doesn't calcify. And then they mount it on this housing, which sutured into the patient. This is a pig valve. This is from cow or bovine valve. Well, I have a sample of that valve, Brandon. You can show them also. Maybe that one, both of them. You can see it. I had a lot of valves, but the new surgeon came. I gave all of them to new surgeon, unfortunately. But that's good for him. So now the latest design, of course, is this one. This is sapien valve, which is thread through from the groin. From the groin, you go with the catheter inside the heart, and in the aorta, in the right position, you deploy this valve, and opens up. So you don't have to cut the patient. Isn't that beautiful? But this is done mainly now in the early patients, but soon I think it's going to be a sort of universal approach for the aortic stenosis. So we have come a long way from being able to do nothing to just making a small hole in the groin and putting a valve. So the next major problem was this coronary arteries. Coronary arteries were a big problem because 600,000 people are dying every year. I mean, that was not, the mitral valve was not that much of a problem, but this coronary is. So the first contributor is Weinberg this is from Montreal, University of McGill in Montreal. He came up with the mammary artery which runs behind the chest bone. He took that down and he shoved it into the muscle of the heart. So the idea was that, okay, it may find some connection. And everybody thought it's a stupid thing to do, but it worked. It worked for certain patients. Came back, this guy, Kolozov, this is a surgeon, a Russian surgeon, World War II, in Leningrad. The Germans have now, for 3 years, they have sieged the Leningrad. And one day he was in the operating room doing this surgery when a big explosive tore the room. But he didn't take his eyes off it. He continued working. And he did that case, and patient did make it. He's the first one that came up with the idea directly attaching the mammary artery to the coronary. But credit goes to this man, René Favaloro. He's from Argentina. In 1967 to 1970, he ended up doing 1,000 coronary bypass surgeries, and all of them survived except 4%, which was magnificent results those days. So for that reason, he's called the father of coronary surgery, and all again came from Cleveland Clinic, both coronary angiography and now coronary bypass. I was lucky that I was accepted to work to get training there. So René was born in Argentina to an Italian family. Ross, this is your buddy. Maybe you're related with them. Probably. Argentina, you said you have some cousin there? 3 cousins. Here we go. Maybe you can look into this. He was trained and practiced as a cardiac surgeon in Cleveland Clinic from 1960 to 1968. Then he went to Argentina, and this is wrong. Should be 68. Went to Argentina. He figured out there's nothing there he can do. Nobody supported him. He came back. Came back to Cleveland Clinic, and then they do the biggest thing they could do. Finally, in 1985, he said, I have to go back home. I have to go help my people. He went to Argentina. He founded the Center for Heart Surgery, or Heart Disease rather, in Buenos Aires, which was the biggest center in South America, mainly taking care of the indigenous people, and government was supporting him partially. But in the year 2000, when the Argentina went bankrupt in 1999, they couldn't subsidize the clinic anymore, and Rene was faced with $75 million deficit. He killed himself. And so sad. He shot himself in the heart, the beloved heart. His nephew then was in charge of the clinic after his death. Now the clinic is doing very well. That's the latest I know under his nephew. Now to come to the heart transplant. Ultimately, we have to do something about this failing heart failure. So it comes to heart transplantation. The heart transplantation, the first person I give credit to is Alexis Correl. This is French surgeon. He's the first one to receive Nobel Prize. The only surgeon I would say has received Nobel Prize. The other Nobel Prize were cardiologists, by the way. This is the only heart surgeon ever received Nobel Prize. For what he did, he took a cat heart and he sutured it to the neck of another cat. And the heart started beating. So for the first time, he showed that you can do the heart transplant. Of course, cat didn't live that long, but the concept was correct. The Soviet transplant took a heart of a dog, this is in 1960, and put it into another dog. The dog survived. Here is that dog. And this is the transplant surgeon, Vladimir Demikov. This dog, on the day 6 after surgery, walked all the steps of Kremlin, all the way up. Of course, this dog didn't survive too long because of the rejection. We didn't know how to prevent the rejection. But technically, it became feasible you can do this. I don't like James Hardy because what I'm going to say, Hardy was a surgeon in Mississippi, in Jackson, Mississippi. In 1964, there was a patient, a black patient, 68 years old, semi-conscious, severe diabetes, severe heart failure, amputated leg. He convinces the sister of his patient to give him a heart transplant. So what he did, he took a chimpanzee heart and replaced his heart with a chimpanzee heart, which never was proven before that you can do this in the history of medicine. And he didn't tell the sister that I'm going to use the chimpanzee dog heart instead of human. The sister all along thought that it's going to be human heart. But he used the chimpanzee, and that heart was too small, and the patient died on the table. So when he presented this information in the Society of Transplantation, everybody just booed him. Correctly, I would do the same thing. That especially those years during civil rights movement in the South, in Mississippi, Jackson, to a black person, you do this. You figure out the rest of it. Okay, everybody has heard about this man. This is Christian Bernard. You all heard that on December 3rd, Sunday, 1967, what happened in South Africa, in Groote Hospital in Cape Town. He, for the first time, replaced the human heart with another human. The person was a white person, 58 years old. The donor was a white person who had head trauma, and he died from a head injury. So they used the heart and used that heart to transplant the person's failing heart. That patient lasted for 18 days. He did the second one, which lasted about 19 and a half months. After 7 more, 8 more, he quit working. But Chambe followed this in the United States. He's the father of transplant. He's the one, he taught the lesson of transplantation to the whole world, actually. Bernard was his student in Minnesota when he was the chief resident. So we learned a lot of technique from him. And the reason he couldn't do it in the US ahead of him, because then you have to have, the law was very strict. The patient is dead when the heart stops, when the spontaneous breathing stops. The concept of the brain death was not yet on the book. It took another year for Harvard committee to bring the brain death as a part. So then Chambé could do the surgery before Barnard. He had to delay for a year before he get his permission to do that. He is the one that contributed an awful lot to the field of cardiac surgery. He was born in Bourges. Now, what about that? He was born in Bourges, and his mother is buried in the cemetery next to Bourges. I had the pleasure to invite him to Kalamazoo for a heart symposium to Bourges in 1995. He gave a talk about transplantation. By then he was retired from Stanford. And then the afternoon, my good friend Dr. Fischel, the cardiologist, myself, Dr. Mack, included 4 of us, played golf in Kalamazoo Country Club, the back 9 of Kalamazoo Country Club. So it was such an honor. I also have Barnard here, Christine. In 1985, I invited him to give a talk. So both these people have visited Kalamazoo, Bourges. So now you all heard about this xenotransplantation. The story broke in January 7, 2022 when the surgeons in Maryland replaced a heart of a person, which is this fellow, with a pig heart. This is the first ever has been attempted. What they did, the company that makes these transgenic pigs made 10 changes on the genetic foundation of this pig. And those 10 changes, 3 of them was on enzyme that causes the cells to be recognized. The signalings that cells send out are the sugars, basically. They knocked those genes in this pig. The transgenic pig doesn't have these 3 enzymes to make those sugars. So the cells of the pig are not going to be recognized by the human immune system. That's the first thing they did. The second was they targeted the receptor for the growth hormone because the pig heart was already the size of the human heart. They didn't want to grow more. So they knocked down the receptor on the membrane that receives this growth hormone signal. So now this heart is not going to grow anymore. And the other genes had to do with the immune system, with inflammation, with clotting. I don't want to go through the detail of it, but altogether, they knocked 3 genes out and tweaked 7 more genes. With these 10 changes, and with the help of cocaine-laced solution, they found out if you soak it with the cocaine, the heart can last longer. The coronaries don't develop inflammation. So this idea came from Sweden, and then finally they used this novel immunosuppressive drug called Kalamazoo Public Library 404. This is new. This works on the immune cells, so prevent them from talking together. So they cannot proliferate, they cannot increase in number, and as a result, the heart so far is holding. This is January 7, we are talking about February 22nd. So this is the future of the heart transplantation. I'm going to send the last slide because I thought that's very interesting. Read it for yourself. Reasonable people adapt themselves to the world. Unreasonable people attempt to change the world. So all the progress comes from the unreasonable people. So I stop here. See if any question I can talk to you. Questions? Yes.
That was just fascinating. I was wondering, how do you control blood pressure during all these drastic procedures, such as when you hook up to the patient to the heart-lung museum or machine? It's going out, and it seems like the blood pressure situation would just go crazy.
Well, okay, the pressure has to do with the amount of blood in circulation. If I take that much out and send the same amount back in, right? So the volume is intact. As long as the vessels are not paralyzed by anesthesiologists, the pressure should maintain. Matter of volume, exactly. The pressure is related to two objects. One is the circulating volume. Number two, the size of the vessels, which has to do with tonicity of the vessel. And as long as you have this tubing the same size in the body, you put the same amount of volume, you have the same pressure. But the pressure drops if you take the volume out. That's why when you bleed, you become shocky, the hypovolemic shock. No, that groan, by the way, also is from pig and cows and horse. They're biological valves. Why biological? Because mechanical valve, you cannot squeeze it into a small catheter to send it up. It has to be something that in a spring, you can squeeze it up, open up. So all of them are biological. We use pig valve quite routinely because pig valve doesn't require you to take Coumadin, the blood thinner. Other valve, that mechanical valve, you have to take Coumadin, otherwise the blood clot will form and eventually causes a stroke.
Hi. Are any heart transplants human to human?
Oh yes, we were talking. The U.S. we do about 2,000. UNOS, which is in charge of transplantation, UNOS in U.S. it controls the number of patients coming in. There are 100,000 patients waiting for transplant, not the heart, but kidney mainly. But the heart is only 2,000 a year. Why? Not because we don't have enough facility, because there's not enough donor. We don't have enough people with car accident. Thank God. That was a joke that in the past they would say Honda helped the transplant the greatest. They're talking motorcycle Honda.
So, Dr. Khaghany, that was wonderful. Thank you. It was concise. There was a lot of information. If I try to take my history back and my history in medicine back to the 1960s, one of the introductions that you mentioned was somebody created the intensive care unit. And having had some experience with a lot of these things, another piece of this has to do with the team of people who are working together to make all of this happen. And it's not just about the machinery and the getting all of that stuff to work together with the solution of several small problems that have been described and figured out over time. To have all of that get coordinated together in a very limited time to work at these things is part of the miracle of all of this, I think.
Absolutely. Absolutely. No question. This is a global progress. But some people were daring to take that. Remember I told you misfits? Of course, if you didn't have enough chemistry, if you didn't have enough engineering, Edward engineer, if it wasn't because of him, this valve were not here. But the engineer needed mathematics. If it wasn't because of mathematics, there was no engineering. So everything helps together. And the reason the United States is so rich because there's so many people in this country with so much expertise that they can solve the problems. I would say the United States is not just because it's the most powerful nation because of the military, which is. But what makes the United States very powerful are the people of the United States. These are the people who move and shake things. Look at the computer science that came out from Silicon Valley. All the stuff that comes up. So yes, I'm all for it. This is all teamwork. And they all work together, a team of people getting together, but they need a leader to say, okay, let's imagine, let's do it this way. And these are the leaders, basically.
Yeah, I have a kind of off-the-wall question. One time there was a facility in Portage that operated, did some experimental work with pig hearts. And the reason I found out about this is that Kalamazoo County was thinking of buying that property and turning it into a animal shelter for to replace the animal shelter that they have now. Now, were you associated or involved with any of that work that Borges doctors were doing there?
I did some of the surgery on the pigs
Oh, wow.
for transplant, for not transplant as much as the stent.
As
When the
what?
stent came, a stent. For
Stents.
coronaries.
I see.
We did
Thank
work
you.
on those pigs quite a bit. So yeah, it was that my contribution was that off time I go there and make some money actually. Make some money.
Well, thank you very much for a wonderful presentation.
You're welcome. Welcome. Thank you. Thank you for your sitting here and listening to me. Thank you. Well, I had the slides. All was on the slides.